Most of us were never taught how to evaluate a claim properly. We were taught to trust the source. My guest today is Dr. Jordan Grant, a former board-certified urologist who spent years inside conventional medicine before leaving to think and practice on his own terms. In this conversation, we get into the reasoning errors that shape what we're told and what we believe, and the practical tools anyone can use next time an expert, in any field, makes a claim that they expect you to accept without question. Jordan, thanks so much for coming on the show, man. I was so looking forward to this, and I appreciate what you're doing.
Thanks for inviting me.
You're welcome. You're welcome. I'd like to talk today about logical fallacies, erroneous thinking, if you will, that's so prevalent throughout all of our language. You hear it, people using it all the time. It's all over social media, but it's particularly prevalent in politics and medicine, probably more so in medicine, I think. And I'd love to ask you some questions about that. But before we start, could you give us a little background as to who you are and what you do, please?
Sure. My name is Jordan Grant. I am I was a board certified urologist. We quit our jobs about 2 years ago, but originally that was my story. I have a bit of a interesting background because I didn't go straight to medical school from college. I worked for a year in finance. Got a finance degree. Hated it, sat in a cubicle all day. Understood that my life was going to not be fun that way, and so I decided I wanted to be a doctor. Well, that led me to more schooling because I didn't have the right school to get into med school, from college. So I spent 3.5 years in Dallas, Texas, getting my prerequisites. And that's when I really fell in love with a lot of the topics we're going to talk about. I had a lot of time on my hands to study theology, philosophy, logic, things like that. And once I got into medical school, that's when I kind of was able to start seeing a lot of fallacies, actually, that we'll talk about. But anyway, I went through medical school, went through 5 years of residency, urologic surgery. And then my wife and I both, that's where I met my wife. We're both urologists by training. And we worked for, I guess, about 7 years in practice. But by 2020, when everything happened, I started really, my mind was open quite a bit to things I'd never even been exposed to, like the whole virus narrative. I'd already been kind of privy to power structures and hierarchies and authoritarianism and things like that, but I'd never gone down these rabbit trails because you don't have time, And so we eventually, I decided we had to get out of the system. I did. I knew I was going to have to, especially about after 2021, and they were doing the vaccine mandates and everything. We stood up against all that. We were ready to be fired, and it didn't come to that. But basically, we finally decided we had to get out. My wife got on board, and we quit our jobs about 2 years ago and decided to go into practice for ourselves, doing, hormone optimization, whatever those are. Basically lifestyle. We talk to patients mainly about lifestyle. Really, it's all the basic stuff about health as best as we can do it. It's really just building relationships with people and being an accountability partner to help them feel better and function better as they age. And so that's where we are. And now I spend a lot of my time really reading and kind of researching these topics that I never had time to in the past.
Brilliant. Fantastic. You ready for some questions?
I'm ready.
Excellent.
I hope I'm ready.
You will be, I'm sure. In both your conversations you had with my friend Dawn Lester, you kept coming back to one question, and it was a really simple one, which is, how do you know that? What makes that question so effective in your experience? And how could someone with no medical training use it when their doctor makes a claim about their health?
Yeah, to me, I think a lot of us are just kind of built that way. Like when I was a kid, I was that kid. I was how do you know that? I would even ask Dad that all the time, and Dad just makes up stories just to placate me, But it was always the why questions. I was driven by the why. I'm the kid in 7 years old in Sunday school, asking the Sunday school teacher about time and eternity and all these concepts. Yeah. And like some of us are just kind of wired that way, but deep down, most people understand those kind of questions. Like, well, how do you know that? And so that's what's always kind of driven me. And in medicine, especially, but in general, whether it's any kind of claim being made, and some of these claims don't matter, right? Some things it's like, okay, does it really even make a difference in my life as to the why of that? Not necessarily, but it's still nice to know. But I think when it comes to medical decision making or some other type of decision where they're trying to push a tyranny on you, in my opinion, whether it's a vaccine mandate or something like that, you need to know why you're going a route. You need to understand that. So the logical thing is to ask, well, how do we know that? And this is a bigger category called epistemology of how do we know anything at all, right?
Hmm.
That's what got me interested in this
Yeah.
is studying philosophy, studying epistemology, especially, which is just a theory of knowledge. How can we account for knowing anything?
Hmm.
And that's a massive topic that we don't have to get in. It's a big rabbit trail. And I don't want to necessarily get into that unless you want to, but it's just that fundamental question of how do we know? And I think it's hard to ask that because especially like as a patient, let's keep this in the medical context. It's it's not fun for doctors to hear a patient ask them. They don't like being asked questions. I didn't mind. I have no problem saying I don't know if somebody asked me like more questions. But from my experience, the majority of experts, including physicians, do not like it when people ask, well, how do you know that? Can you back that up with some evidence? Can you take me
Hmm.
some steps backwards? So but it's important because if you think about where we're at in medicine with all the testing that's done now and all the interventions and diagnostics that are actually harmful and then treatments quote unquote that are absolutely harmful,
Yeah.
I think it behooves everyone to just be able to sit back and ask, how do you know that?
Yeah.
And so it's empowering on that end because if you get a BS answer, you're probably gonna. I mean, you have to be a little savvy to know how to filter through answers, right? I mean, the doctor could just say something, and then you go, "Oh, okay." And I've had patients do that where I'll tell them like, "Well, here's what we think," and they'll go, "Okay, that's good enough for me." Now I'm more like, "Hey, here's some papers, here's some books, go read this." Go, they'll ask me questions about cholesterol, statins, all these things. I'll go, "Here's some stuff to go research," because I want people to be empowered as best they can. But
Hmm.
that's a long answer to a question, but I think that's just the basic starting point for any kind of positive claim. When somebody makes it, you just kind of go, how did you get there? How do you actually know that? How is that verified?
Hmm.
And that can lead to a whole series of other questions.
Yeah. But it's a really good start point, though.
Yeah, I think so. And
Yeah.
and like I say, I think there's times you don't want to just be a jerk about it for every like if I have a contractor over here at the house building something and he starts telling me some things, am I going to every single thing he says go, how do you know that? How do you know that? I mean, you could really tick somebody off pretty
Yeah.
quickly that way. At
Yeah.
some point, we do trust
Hmm.
certain people to do a thing. And then when they do it wrong, you go, well, I guess they got it wrong. I think with medicine and with health, when it's your own body, that's a little different than a house or a
Hmm.
car, somebody working on, so I think
Hmm.
it's more important to ask.
Yeah.
Yeah.
No, I agree with that. The next one I wanted to cover then was you said that affirming the consequent is everywhere in medicine. The fallacy where doctors see an effect and then assume a specific cause, but with no proof. Could you maybe give us a real world example from something maybe like a blood test or a diagnosis, and then tell us maybe some questions or a question that we could use to catch this when it's happening?
Yeah, and this was the main fallacy that I fell in love with basically prior to going to medical school. I was reading a lot of philosophy, philosophy of science, quote unquote, and seeing even Bertrand Russell, the great Bertrand Russell, admitting that all scientific arguments come down to inductive fallacy and affirming the consequent. And what affirming the consequent it's just a formal logical fallacy, and form means the form of the sentence of the syllogism. It's if A then B therefore A, right?
Mhm.
And that is always fallacious. Like it may be true, but you can't know it's true based on that
Yeah,
argumentation.
yeah.
And so we see that everywhere. It is not just in medicine. It is the MO of most people's arguments. When you ask them to prove something or validate it, what do? They point to the effect to bolster their claim of cause. And you go, no, 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 I want to know about the cause. How did you
Mhm.
verify the cause is even real? And then that it caused the effect. And they always end up in a circle.
Yeah,
So it's basically a form of circular reasoning.
yeah.
And this is prevalent in medicine in so many ways. I would say the number one way is because of lab testing. And lab testing is really one of the biggest hoodwinks out there. If you really get in the weeds with labs, and we can go down that rabbit trail if you want to, but because you start realizing that a lot of these entities that are claimed to be represented by the lab have never been proven to even exist in reality.
That's tricky then.
It's and people would never really, I don't think, even buy it. They'd say no, that's not possible. It is. It's the way it is. If you actually dive into and go look in, okay, what is cholesterol, right? Let's just take cholesterol and you go look at how that was ever quote unquote isolated or found. Well, it wasn't. It was created by men in a lab by doing stuff to tissues, many steps, man-made steps, boiling, heating, acidifying, using solvents, dehydrating, getting a powder, getting a waxy substance, and they just call it. It wasn't even cholesterol at first. It was cola something, and then they changed the name to cholesterol. Um, and they try to, and I don't know originally if they actually claimed this is actually in the tissue or here's a lab operation we've done to get this stuff at the end.
Mm-hmm.
That would be honest. But what people have done is they've taken these man-made things and then they insert them back and go, no, these are constituents of reality.
Whoa.
And so that is called reification. I know we were going to get there, but that's a reification fallacy, meaning you take a concept and you claim that it's actually an ontological reality. And that just can't be, you can't do that. I mean, you can, but there's no basis in reality for it. And if you start looking at any and all of these labs, so far I've yet to find anything that's not a man-made operation that they've just then claimed this exists in the body. And then the pathways they use in the outside in the test tubes, all these things they do to convert these things, just chemistry, right? They'll start claiming those are happening inside your cells. It's insane. It's literally insane. And
Wow.
it's been a big, I started looking at this, a few of us did a couple years ago with quote unquote genes or
Yeah.
amino acids.
Mm-hmm.
And you go, what is an amino acid? Have you show me a one singular molecule of it? And you go look at the original papers for like nucleotides, and we found one on guanine. Guanine is supposedly a nucleotide that's one of the letters that makes up, a gene, right?
Mm-hmm.
There's A, G, T, and C, and all these things. So you go find the paper for guanine. All they did is just dehydrated a crap ton of bat guano, and they got a powder at the end, and they tried to start making a claim that that's one of the constituents of a gene, like that's a nucleotide. It's
Okay.
absurd. I mean, I couldn't believe it honestly at the time. That's before I'd researched this more. Now I realize the recipe's the same everywhere.
Yeah.
But we laughed so hard. It was like a French paper, and one of my friends she translated it for us. It just blows my mind. But that's where you start with the fallacy, and then what they'll do, and we can take cholesterol for an example, or any of these things, where they'll make a lab test against that. They'll use a reagent and they'll apply it to that man-made product, and they'll get a color change. Basically, that's all these instruments are reading, color changes or something on a man-made device. And that's fine if you're just doing that with the stuff you've made. But the problem is they'll then take that same reagent and apply it to human blood, human serum, or something like that, and they get a color change. And then they just compare the color change to the color change they originally saw when they compared that reagent against the waxy substance. And they say, you've got this level of cholesterol.
But it's two
in your
different
blood.
things.
They're two different things. And they have no way to know that that's specific for that, because you could apply that reagent to anything, get a color change, but you have no way to validate the meaning of it. And this all goes back to meaning. That's my, when you ask about how do you know something, we're really asking about true meaning.
Yeah.
Where affirming the consequent comes in is just, that's what they do. They say, if this disease, because they'll correlate cholesterol levels with like people's health status, even though it's all over the map, they still love their correlations, which is fallacious in of itself to use that. But they'll then say, if this, then that, therefore this. So if you have high cholesterol and are, at risk of a heart attack, you will have these levels on a blood test. You have high levels, therefore you're at risk of a heart attack, and even though you go, well, wait a minute, there's plenty of people that have high levels that never have heart attacks. And there's plenty of people that have low levels that do have heart attacks. So where did you ever come up with this cause and effect? And the issue here goes back to science, and the scientific method is they've never been able to manipulate. You can't manipulate cholesterol as is in reality in a human being to even see if it causes any kind of effect. That's not how any of this is done. This is the same with all lab work. All lab work is based on, number one, these reifications of compounds that nobody knows if they exist, even in the body or the inside of a plant or anything, a vitamin, same thing, same issue. But then they correlate these levels with certain things, and then they just make up stories about it. And so I think at the end of the day, in medicine, especially, I think people think medicine is science. And I have a problem with science in general. I've been a stickler about science for a while, about adherence to the scientific method, trying to prove cause and effect. I don't even think philosophically that's actually achievable, because you're still affirming the consequent at the end of the day. But in medicine, it's even worse, because nobody's manipulating these real entities, or fake entities. They're just correlating and making up stories. And that's a problem. I mean, to me, that's a problem. If you're basing massive health decisions off of spurious correlations with entities that haven't been proven to exist or cause anything, that I think people need to know that, so that they're and the problem with that is going to be, you cannot talk to a doctor about this. They have never heard of this. They have
Yeah.
never looked into it. This would be so far, and they would look at you with just this look of incredulity,
Mhm.
and blow you off. So
Well, they
that's
probably
the
say that you've
detail.
been speaking to Dr. Google again.
That's right. That's what they'd say. They'd come with some ad hominem,
Yeah.
some fallacy. They do a personal attack against you, because they don't know. And it's not fun when doctors who think they know everything realize they don't know, and somebody knows more than them. I learn a ton from my patients all the time. And not necessarily because they even know more, quote unquote, because they ask good questions.
Yeah.
And I go, you know what? I don't know. Let me go look into that. And that's opened my eyes on a lot of things. So
That's really interesting. Thank you. I think one of the other things that I've certainly seen recently is correlation equals causation. And it also strikes me that a lot of these are just kind of variations of a similar thing all the way through. So, for
100%.
example, you take antibiotics, therefore you get better. In other words, the symptoms get suppressed. Therefore, the
Yes.
antibiotics cured you. Maybe you
Yes.
could walk us through why this is fallacious reasoning and maybe what alternatives might be missing in that.
Yeah, well, the form is already fallacious. It's an if A then B, B therefore A. It's like, if antibiotics worked, they will suppress your symptoms were suppressed, therefore antibiotics work, because they'll say, if antibiotics work because of killing bacteria, then you'll feel better when you take this. You did feel better, therefore it was because of the reason we said. That's fallacious always. That's always a fallacy. It may be true, but you can't appeal to that as true, as the reason is
Yeah.
true. The other thing is, you have to go into a lot of these other issues about, well, what does it mean to get better? Better how? Is suppressing symptoms a good thing, right? We have to go down that rabbit trail too. Like, there's all these levels to these topics that nobody ever thinks about. And
Yeah.
especially in allopathic medicine, the name of the game is symptom suppression.
Yeah.
And I think deep down, a lot of doctors would actually admit that. I think they would. I think they would admit, like, yeah, we're just helping the patient to, quote unquote, feel better. The problem is that can be very detrimental. The second issue is, you actually don't know that taking X caused anything, because you can't prove a counterfactual. You can't prove an alternate reality. You don't know how you would have felt had you not taken that pill.
Yep.
You might have gotten better, quote unquote, in the same amount of time.
Yeah.
This is the problem with any kind of cause and effect proof in reality, because it's always that post hoc ergo propter hoc, like, after this, therefore because of this fallacy. And it's
Yeah.
very similar to affirming the consequent,
Yeah.
but basically appealing to something that, because it happened after this, it was because I did that. And that bothers the heck out of me, especially in medicine, when they claim these studies talking about prevention.
Yeah.
You can't prove prevention. That's insane. Like,
Yeah.
the example I always give people is, like, that's like me saying I carry around a pet rock to prevent me being hit by a car, and then I go, I've yet to be hit by a car, so
Yeah.
hey,
Pet rock
my
works.
pet rock must work, right? And people would understand that example, right? They
Yeah.
think that was stupid. They
Yeah.
go, that's silly. And I go, it's no different. It's the exact same type of reasoning as these prevention claims. The correlation versus causation, again, same thing, because we know that you can correlate anything you want, really, and that
Mm.
certain things track together, but that doesn't mean there's any kind of causative cause and effect relationship there. There's a great website, I cannot remember the name, I think it may be like spuriouscorrelations.com,
Mm.
and he gives all kinds of insane correlations where things track, and people would look at it and go, that's insane. Like the vicinity of Nobel Prize winners to an IKEA furniture store, and you can correlate those, and then people go, well, see, that you must be a Nobel Prize winner because you live close to IKEA,
Yeah. Yeah.
but I mean, and see, it's
Yeah.
funny,
Yeah.
but yet that's
No.
no different. It's literally no different. And then my big issue too, with medical studies in particular, is that you can never, and this goes back to the counterfactual thing, you cannot show what was going to happen in any one individual. So what do? They compare different groups of individuals. And they say, okay, here's the intervention group over here, and this effect was seen, and here's the control group over here, and we didn't see the effect. And that can be useful, especially if it's an all or none. Like if nobody in this group had that effect and everyone in this group did, but
Yep.
that's not how reality works. If you go look at these papers, go look at the scatter plots for each group. They're all over the map for who achieved that effect and who didn't. And so again, they're still just sort of making up a story based on statistics. And I think statistics has hoodwinked the world, and I think it's deep down because people finally started figuring out that science, quote unquote, couldn't do what it claimed. And,
Hmm.
and I'm reifying science as an entity that thinks it doesn't. But people who think that way, people who would always claim, science is the end all be all for knowledge,
Yeah.
it's not at all. Epistemologically speaking, it's a train wreck. But people pushed that forward for a
Yeah.
long time, and then I think they finally started figuring out we got to start using statistics to make these stories, because we can't do it otherwise. So
Mhm.
that's some things people need to understand. I think that pretty much all medical studies are based on correlation, and I'm not saying that means they're useless. We use studies like that in urologic surgery. Like I like those kind of studies for surgical interventions, mainly just to show maybe like a non-inferiority. Like, yeah, this was no worse than this, statistically,
Mhm.
and this one was safer statistically. So yeah, maybe I'll try that. Does that mean it's always going to be safe for the patient? Nope. Does it mean it's always going to work? Nope. And so that's the issue too, is like we don't know the future. And to try to generalize a particular to a universal is also a fallacy. It's a fallacy of induction. That's all studies are taking particulars and then generalizing them to a universal claim, and you can't do that. So,
No, that's fascinating.
yeah.
So when someone says studies show or research proves about a health claim they're making, what logical fallacies might typically be hiding behind those phrases and how might we
Um,
unpack them?
Again, the main one would be affirming the consequent,
Mm.
I think, because you're still appealing to an effect to claim proof of cause at the end of
Mm.
the day. Um, but when people say research proves, I don't think they understand what would be required to prove something.
Yeah.
And so, in my mind, a true proof is a logical proof. A logical proof meaning a deduction. A deduction is arguing from a known premise to a conclusion. So you're basically going from a universal to a particular. That is legitimate. Caveat is, how do you know your premise is true? So that's a separate topic. That's
Okay.
epistemology,
Yeah.
but at least that's arguing, in a certain fashion in the right way. For proof, you would literally have to clone yourself into the multiverse and only change one variable and only that one variable to see what happened, which is obviously impossible. So when people say research proves, they're usually, again, they're going back to correlation.
Mhm.
I would never use that phraseology ever in my life again, because I know it's fallacious. But that's what they're doing. They're basically just appealing to correlation as causation and saying it proves it. In my opinion, the best we get out of correlative studies is falsification. Okay. I don't think you can prove something true. I won't go so far to say as you can prove it false, but I think if you show no association, in my mind, if there's not an association between something, well, something that causes something should be associated with it too, right?
Yeah. Yeah.
So if you don't, or if you aren't able to associate it, you can probably mark it off the list and go, I'm not worried about that, and that's what I try to tell people with a lot of these studies now, even with cholesterol and things like that, where they get freaked out about these numbers, and I go, there's no evidence. It's kind of been falsified, in my opinion, that this is actually truly associated worldwide with heart attacks or with heart disease or cardiovascular disease. And you can do this for any kind of topic. And there are some things that are correlated. And then you go, I don't know. At the end of the day, like you take your risks because you don't know. But if you can ask somebody, well, how do you know that that caused that? And they can't even tell you, that should make you pause, I think, and go, let me go look deeper into this before I follow you down this pathway.
Mhm.
But yeah, the whole research proves X or research proves this or that. Again, there is no kind of research that can truly prove anything in a logical proof kind of way.
Mhm.
People will appeal to mathematics, and math is just a language. Okay, math is no different than using words, and you can use math for fiction or nonfiction, just like you can language. I
Yeah.
can have a perfectly coherent, logical story that is completely false. and all the logic still works. We love those. They're called fiction books. We read them all the time, right? And it's the same with math. And I think people don't understand. They get hoodwinked by, I think, a lot of people that really think math is truth. And it's like, no, math is a language. You still have to have true premises to be able to get to true conclusions and real variables. I can't just start making up fake variables and inserting them into equations. But that's what's done. And that's done in science. That's done with all kinds of different topics. And you'll see that because what happens is they'll reverse engineer an effect backwards and just, well, you can insert any variables you want because you already have your outcome. You just got to make it all fit.
Yeah.
And that's what they do. And I know that's not the same topic as what we're talking about, but I just wanted that to be, people need to understand all the little details, I think, that go into these studies. And the math, in my opinion, where it really gets hoodwinked is with statistics, because statistics is miserable if you've ever tried to learn it. It's actually absolutely, I hated it because I knew it was all nonsense. I knew at the time. I was like, this has nothing at all to do with what's going to happen to a single individual in the future. Nothing. When people would come in and talk to me in urology, and let's say we gave them a diagnosis of prostate cancer, whatever cancer is, I don't know. But let's say that, and they would be like, doc, what are my chances? What are statistically my chances here? And I'm like, there's no such thing. There's no such thing as chance.
Yeah.
Whatever's going to happen to you is going to happen to you, but that has nothing to do with what's happened to anybody else at all. Like in cancers, or even like, let's say a screening test, like before they even get a diagnosis, get a PSA level, right? PSAs are notoriously crap. They're not specific or sensitive for cancer, but they'll still want to get these tests. And then they stratify them and say, okay, if you're at this range, you've got X% chance of having cancer. Again, there's no such thing as having a chance of having cancer. You either have it or you don't. It's like being pregnant. You're either pregnant or you're not. You're either alive or you're dead. There is no chance here. What they're doing is looking backwards and correlating how many people with this PSA level had cancer versus who didn't. Well, there's plenty of people who didn't, right? So people get worked up and overstressed by these tests. And that's another big problem I have with this, because number one, the tests are not testing for what they claim. And number two, they're correlating backwards and looking historically and then trying to predict the future. And that puts people in a state of insane fear and stress. And we know, or we think we know, what stress can do to the body. I don't think it's beneficial, like that kind of stress. I think some stressors can be. So sorry, that's a long-winded way to answer that.
No, that was really useful. Thank you. I like the way you wander off with things. It's really cool.
I'm good at it.
You mentioned reification earlier, treating abstract concepts as if they're concrete reality. How would that show up in lab work or medical diagnosis?
Yeah, kind of similar to what we were talking about with the with cholesterol. It's the same thing with basically any lab work. Is that these entities that are being claimed to be found on the blood test cannot be shown to exist in reality. They are the end result of lab operations. And this is where we get into the whole scientific realism versus operationalism debate. Dawn Lester and I talked about that on our podcast recently. I think it's a topic that has become fascinating that I didn't even know about until really recently. I was kind of already exploring this on my own because we've been asking for years, like, let's look at these papers and see what's actually done at a macro real world level. I don't want any of the lingo, the molecular lingo, the atomic lingo, just what is done, what is claimed, and if that can be valid, justified. And sure enough, you start looking deep enough into this. This was a major topic for a long time in the scientific, or at least philosophy of science circles. Scientific realism, and realism are people who basically love reifying things, where they basically take some experiment, quote unquote, or some end effect, and then they make up a story about why that's occurring. And they call it a theory. That's not how scientific theory should work. But anyway, so they'll insert atoms, photons, electrons, gravity, whatever it is. They'll insert some imaginary placeholder and claim that as reality. That's reification. You're taking it's the fallacy of misplaced concreteness. And the example a lot of people give is usually like maps. They'll say the map is not the terrain you live on. So if you reified a map, you would be claiming the map is actually reality. Well, obviously it's not. And lots of different types of maps still work to get you where you want to go. Yeah. They could be all different shapes. They could all be different layouts. Like we've all seen that. It's the same thing here where you're reifying something imaginary. Energy. the concept of energy is reification. Energy is an equation. It's just like the ability to do work. And then people start talking about conserving it and this and then transferring it. It's like you're transferring the ability to do work. Like, what are you talking about? A really good guy on YouTube to watch is his name is Dr. John D, just the letter D. And he has given some awesome presentations on how this all, and he goes on one on energy. And he gives some amazing examples of this. And he even gives fake equations to show how easy it is to do this. He's like, we could come up with an equation to show your level, the level of Britishness that you are. And we take the number of beers multiplied by something else. Like, it was hilarious the way he was doing it. But you reify that into reality and then make that an actual ontological claim about a person. Nobody would accept that, but that's what's done. And so I think that's the issue. So reification definitely is common, but it's not just applied to this. Reification would be like, it's like what Anthony Fauci said, I am the science, right? You're reifying science, which is supposed to be a method, into an actual person. Or somebody says the science says, well, science doesn't have a mouth, right? We see this a lot of time with collectivization.
The,
People
the company says this. No, it doesn't. It's a plaque on a
Yes,
wall. It's a piece of paper. It's an abstract idea.
exactly. There is no such thing as a company doesn't have a mind. Only individuals can think. That's it. And that's a big, I'm not a collectivist at all. I'm very anti-collectivist. I'm very anti-statist because it's collectivist. And so when people start saying, well, America says this and America does that, it's like, there's no such thing. There's just people. There's people in the government doing things, and then there's you as an individual. We're all individuals. Yes, there are groups of individuals, but a group cannot speak unless you give your consent over to someone else to speak for you. Anyway, different topic. But yeah, I think reification is actually a fascinating topic. And, you know, the fallacy really being committed with this lab work is called an as-if reification. They are treating operations and concepts as if they are reality. So, yeah.
Nice one. That was really interesting. Thank you. So on the subject of lab work, let's talk about normal ranges on blood tests. I think you call them is-ought fallacies. What does that mean in plain English? And what would be a useful framework for interpreting lab work be?
So we'll start with the is-ought fallacy. And that's something, I think it was David Hume that talked about that a lot in one of his books. And I can't remember the name of his work now. Very, very famous epistemologist. He was an empiricist who eventually ended up eradicating his own empiricism and becoming a radical skeptic because he realized you couldn't account for anything with empiricism. But he basically was talking about you cannot get an ought from an is. And we all have heard this before. A lot of people have heard the difference between something that's prescriptive and descriptive, right? It's talked a lot in theological circles, like in the Bible. We'll say just because something is describing a situation does not mean that's an ought or a prescriptive situation that somebody should be doing. And it's the same thing in life. You cannot get an ethical norm or a prescription of what you ought to do from something that just is, from a description. And I like to talk about this a lot of times in terms of like natural law. People will say things, and I know what they mean when they talk about natural law. We're talking about private property rights and those things. But you cannot derive rights from just looking at nature, okay? If I just look at nature, well, guess what? It's insane. What do I pick? There's murderers. There's lions that are killing their young. There's all kinds of crazy stuff going on. So that's all I get. I just get descriptions. I don't get ought from that. It's a category error is basically what it is. You cannot, you're smuggling in something into your conclusion that wasn't in the premise, which is that some type of ought claim or ethical norm. The same thing applies to blood work because you're looking at ranges in a group of people, which are just descriptors. You're descriptors of numbers, and then you average them. You get the normal. So that's, people hear the word normal and they think ought. They think that's a good. That's not what the normal is. The normal is the statistical norm. It's just statistics. It's just the average, right? You get a bell curve, you get your standard deviation, you're in the middle. That's what lab ranges are. Well, those depend on the population you're studying. And the example I give a lot that's easy to understand, I think, well, let's go back to cholesterol. If you take a sample of certain people eating a crap diet and you get their average cholesterol numbers, that's going to be over here. And now let's take a people eating a carnivore diet where they're eating meats and animal fats only. And these people are doing fine. They're healthy. They're over here because guess what? Their cholesterol numbers are completely different range than these people over here. And does that mean one is better than the other? In and of itself, no. That doesn't have anything to do with where you ought to be on that spectrum. And then even within those groups, you have variations all over the place because we don't know what those numbers mean. And I want to touch on that again real quick, and I'll get back to the lab range part. But man, I lost what I was going to say. Um, the issue here is that just like you can't take these variations and make any positive claims out of them like they're trying to do. Like I said, the cause and effect issue is it's really hairy. But I had a thought and I lost it, so we'll get back to the range. I'll probably come back to it.
Mhm.
This is how I am, just stream of consciousness. I'm sorry.
I'm the same.
But I talked about this with patients all the time because they get so freaked out if anything is in the red, right? Because we grow up in school and anything marked in red is bad. So they see these lab numbers and they come back out of range, even if it's like a tenth of a point, they freak out. Oh, doc, I'm not in range. I'm like, so what? What does that mean? What do you think that means? And I'll have to tell them, well, the range, here's how it's done. Here's how it was developed. We do this a lot with hormone therapy, like, because I'm still a believer in being pragmatic. And I don't think there's a place where we can't ever use a medicine or a pharmaceutical or an herb or any kind of technology to try to achieve a certain effect. It's just pragmatic, though. I'm not claiming science. I'm not claiming anymore that we're replacing something that's going on in your body, that we know how it works. Like, it's all nonsense. But that doesn't mean we never wear eyeglasses, right? Some of us have to wear glasses just because our eyesight's bad, and it helps. So I'll tell people, like, when they get their, let's say, testosterone levels back, when they're taking testosterone and their numbers are above normal. Well, yeah, because you're taking it. The normal range wasn't made from people taking a compound. The normal range are just baselines, and nobody even knows what that lab means. And that's what I wanted to say. That was my stream of thought. These correlates of these non-existent entities, when you get a lab number, right? When they apply a reagent to your blood and something pops up, a color change occurs, we don't know what that means because that entity they're claiming to measure has never been shown to exist. It's probably scaling with something real in the body, but we don't know what that is.
Yeah.
So that's the issue. When people get freaked out and they go, what is the meaning of this lab? You go, your guess is as good as mine. You might as well flip a coin. And people don't like hearing that. I mean, I say
Bet they
that
don't.
they don't, but it's honest. Like, it's the
Yes.
truth. And
Yeah.
I say it all the time to patients. I'm like, you may as well flip a coin as to the meaning of this. And then we get into, what are you doing? Are you being healthy? Are you eating right? Are you working out? Are you doing the basics? You getting sunlight? Sleeping well? Like, if you're doing all the right stuff, what is that lab number going to change? Well, depends on your mindset about modern medicine. If you're an allopathic, believer, you will go down every rabbit trail a doctor tells you to go down, all based off of just one stupid lab that might be out of range. I see people do it all the time, and then you end up getting diagnostic tests and biopsies and imaging and exposure to radiation, and you may end up getting a surgery. Let's take the example of a gene, quote unquote. Okay. You get a BRCA2 gene test that's positive. What are women doing? They're literally cutting their breasts off.
My stepdaughter, who's just 33 now, had that recently because of the gene. And I said, look, here's the information that I know,
Oh,
but she said that I can't run that risk, Adrian. So she had a double mastectomy.
yep. And that's what it comes down to, is your level of perceived risk.
Yep.
But I think people would change their mind a little bit if they understood that these tests aren't telling them what they think they are.
Exactly.
Like that's the gene issue is one of that and the virus one are the biggest one, in my opinion, because of what people end up doing to themselves. But honestly, all of these labs, cholesterol, look at all the statins that are being given. Look at all these horrible drugs based on a number that nobody has any clue what the meaning is. But
well, it's not only that; it's also based on reality, because you said it's exactly. Not even it's a number it might as well be the amount of lime scale in my kettle.
That's right. It's a construct. That's a great one. I tell people all the time, you might as well correlate how you feel with the length of your fingernails. You know what I mean? Yeah. You could pick anything you wanted. That would be more valuable and real than this crap they're testing, because nobody knows what those are scaling with. Yeah. At least with these other things, I mean, true empiricism is just, what do we see in reality? That's all empiricism really is.
Yeah.
people have taken that and made it mean something else, where they insert all these unverifiable realities,
Yeah.
behind the scenes. But you just can't know it, And so my example I always give, and this goes back to affirming the consequent, but it applies to this conversation. I'll tell people, like, if unicorns are invading my lawn, then I will see trampled grass in my yard, and then I go, I see trampled grass, so there's obviously a unicorn problem here. And most people would go, that's insane. You need to show me a unicorn. And I go, exactly.
Exactly. Yeah.
So same thing with all this other stuff. Show me cholesterol inside my body and what it does, and verify the claims you're making, all these little cartoon mechanisms that you're drawing and all these little receptors and all this stuff. Never been seen. Antibodies never been seen. Vitamins, you can't do it. It's philosophically impossible. And the reason I think that, and people may call me crazy, my example for that, or analogy, is that we cannot unbake a cake, right?
Yeah.
I know the ingredients that go into a cake.
It's not the
I
same
can't
when it's
pull out
baked.
the
Yeah.
You don't know what's in the body. You don't know what's in a tissue. So you have no standard. God didn't give you the recipe to unbake the tissue and pull out the constituents. So what do men do? They just arbitrarily choose to do stuff to tissues, and it's all chemistry.
Yeah.
And I think, at the end of the day, chemistry is not natural science. Chemistry is technology. Chemistry is just men making stuff, and there's nothing wrong with that.
Yeah.
What the problem is when you invent a category called biochemistry and try to claim that all these things you're done to create different little things are really going on inside the body that way.
Yeah.
And it's to me, it's the height of arrogance.
Yeah. It's MSU. They just make shit up.
I love it. Yes, I've used that one too. Make shit up university, MSU. Absolutely, absolutely.
So when a doctor says to you, you need this treatment or this medication is going to fix your problem, what logical fallacy might they be committing, even if they don't realize it? And what would be a respectful way for someone to push back and get more accurate information?
I mean, that still goes back to the how do you know that question. Always at the end of the day, it's like, how do you know that I need that? It's kind of an appeal to the future fallacy in a way. I think that would probably be the name of it. That they know this is going to happen, and therefore you need this. Otherwise, you are going to succumb. I mean, it'd be like an oncologist telling somebody, you need to do this chemotherapy treatment or you're going to die from your cancer. Well,
that's pretty much what my girlfriend was told, except he pointed at me and said, if you listen to him, you will die.
Exactly. Yeah. That is just fear mongering, baseless assertion is all that is.
Yeah.
I cannot stomach that kind of stuff. And I think people, again, it goes back to your trust in authority, your trust in physicians, your trust in the system. So there's all these layers that you have to break down. And I'm not telling people just stop trusting everybody, but it's like Ronald Reagan, which I'm not a political guy, but trust but verify, right? Like that saying, trust but verify. Okay, why do I even need to trust you if I had to verify? I either trust you or I don't. If I trust you and I have faith in what you're telling me, I'm probably going to go down that route. If I understand some of these concepts we've been talking about, and you start pulling these little buzzwords on me, those are things patients need to hone in on. When they say stuff like, you need to do this or else this, they may be right. I mean, they really might be. I mean, I have told people that, not from like a definitive standpoint, but especially when it comes to surgical stuff. And I do have a fondness in my heart for certain surgical sides of things versus the medical side of things, because it's more empirical. We can see things going on. Like as a urologist, I can see on a CAT scan if you have a stone stuck in your ureter and you've been trying to pass it for 2 weeks and now you're in miserable pain. You're like, I just want it out. I can tell them you probably need this surgery or you may not pass it and your kidney may get damaged or you may develop some kind of sepsis or whatever. Do I know that? No. I can just tell you, you've been struggling with this for 2 weeks. If you want to, you can keep trying to tough it out, or we can do this intervention. That's how that goes.
Yeah.
When they're starting to make claims about the future, about cancers and all these other things, you get into the weeds real quick. Nobody even studies quote unquote cancer in reality. They study molecular markers, quote unquote, and petri dish studies. And nobody knows what cancer really is. And they sure as heck don't know what will happen to somebody if they don't do the traditional treatments. That's not studied either. And nobody, it's not ethical to study the control groups of doing, lifestyle intervention. It's like, that's not an excuse. That's, you don't get to make up reality just because you're not comfortable with how studies are supposed to work, But yeah, I don't know if there's a specific name of that fallacy. but I just call that a baseless assertion and appeal to the future fallacy.
Yeah. Yeah. Cool. Thank you.
Yeah.
So, if someone's doctor told them that your symptoms are definitely caused by a specific condition based on test results, what's likely to be going on there, and what would be a good follow-up question or questions they could ask to get further into that?
Kind of the same thing where you ask them how do they know that, and you go, okay, this lab shows this,
Hmm.
and you could easily probably just say like, so in 100% of cases when somebody has this level, what you say happens. Like you could kind of ask it like that. Like, can you just sort of clarify? Like, and then they might say, well, no, but you go, so you don't really know for sure. That would be a way to maybe disarm them.
Yeah.
Um, that's the only way I can kind of think about doing it,
Hmm.
because there is no way for them to know. And again, these labs are not specific, and we know that. Even doctors know that. They look at the HIV test. It's like it could be positive for 70 different reasons of things, but they'll still try to tell somebody, well, this means you're going to die, and so you need to take these quote unquote antiretroviral medicines. It's just insane to me, that they can do that. The other thing is, what's interesting is they'll be, well, that's a false positive. It's like, so what's the true positive? How did you verify the true positive? And if it's a false positive, how do you know in all these other cases it's not a false positive, right? Most of these times there's no such thing as a false positive because the entity they're claiming to measure hasn't been shown to exist, like a virus. Like you
Yeah.
can't you can't get an antibody test against a virus that's never been shown to exist. You're literally just mixing chemicals with human blood, getting a color change and saying you're positive, you're negative. And that's why people would flip-flop during COVID day to day. They do these quote unquote antibody tests. One day they're positive, one day they're negative, one day they're positive, next day they're negative. David Crow went over that before he passed away in Infectious Myth, showing studies from
Yeah.
Korea and China, all these antibody tests. And that's what got my wheels turning, originally about all this stuff. And then you look into antibodies and you realize it's a complete joke. But it's the same kind of stuff where they're trying to claim specificity for something when they cannot do that epistemologically, they cannot justify it. Then they use an affirming the consequent fallacy to bolster their claim. If this, then
Yeah.
this lab result, therefore this. And
Yeah.
so you got multiple fallacies going on. And the hard part is really disarming,
Yeah.
I think, the provider in a kind way. And I am not probably the best person to ask because I'm very black and white in my
Yeah.
thinking, and I'm pretty darn. I like to call a spade a spade. I like to call things what they are. I don't like beating around the bush. I don't like political lingo. I stopped going to surgical meetings because nobody would ever just say the truth of anything. You know what I mean? Like I just cannot stand when people don't say what
Yeah.
reality what's going on. So it is probably this is something people are going to have to figure out too, and it's all going to depend on the provider they're talking to.
Yeah.
You will often find some providers that are a little more open-minded that when you kind of just go, well, tell me a little more and give me some more data on that. And that's what patients would do with me sometimes. They wouldn't come in hostile. They might have a notepad, which was always a little kind of, ooh, what's going on? But I actually appreciate it because I grew up, my mom did that. She had a notepad everywhere and she'd take notes because she wanted to know stuff.
Mhm.
And I think that's a good way to do it. Is just, be open to what they tell you, but you don't have to commit right then and there. I think a lot of people think they have to make that decision in that quick 10-minute visit with a provider right then and there
Yeah.
because they will use fear because there is providers, especially in allopathic medicine, if they're good at one thing in general, I'm generalizing here, it's fear mongering.
Yes.
It is insane. I mean, you see it with the vaccine stuff, you see it all over the place. Like and I see it with lab stuff. I see providers tell my own patients, they'll get a blood work and their testosterone level will be 1,000 or something. And they'll go, you're going to have a stroke. And I go, can you show me any evidence where testosterone was ever proven to cause a stroke? And of course, you can't find that at all
Yeah.
anywhere. It doesn't exist. But yet they'll say it as true and they scare these people.
Yeah.
And so, you gotta really pay attention to the type of provider you're seeing. In my opinion, if you're seeing someone that's that quick to jump on the fear mongering train, I'd probably go, thanks for your time. I'll think about this and then go find somebody else to talk to.
Yeah. It's an interesting high pressure sales tactic.
It is
Yeah.
100%.
So you've talked about scientific jargon quite a lot. How would that be a barrier to people, and what might they do to maybe get it explained more simply?
So I would ask the provider to explain it in layman's terms.
Yeah.
What we did as urologists, it was a little easier because, we could draw pictures. I mean, I would literally get up on the board or draw a piece of paper, draw the urinary tract, put the stone in there, circle it, show them what's going on, how fluid's backing
Yeah.
up. Like people understand that, but that's just fluid mechanics and plumbing. People kind of get that. When it comes to these other topics that are invisible entity level, that's when
Invisible
they're going to
made
have
up entity level.
exactly. Yeah, yeah. No, really,
Yeah.
because anybody can draw the cartoon models that we're all taught in the
Yeah.
textbooks. That doesn't mean anything. But to a lot of people, it does. To a lot of people, they will buy that and go, "Oh, that's what's going on in my body. Oh, crap, I really do."
Hmm.
Oh, that gene is causing the expression of these proteins and causing this cancer. Okay, sign me up for a mastectomy. I mean, you're going to always have those kind of people, but I still think at the end of the day, if you can just kind of ask your provider to explain it in layman's terms and then still ask more follow-up questions and go, okay, so you're saying that gene is causing my cancer. Does every person with that positive gene test have breast cancer? And then they're going to go, if they're honest, they're going to say, well, no, that's not how it works. Okay, oh, we're back to correlation here. So you don't know what that means in my body.
Hmm.
No.
Yeah.
Okay, so maybe I should wait until maybe what if I just develop a breast tumor? Maybe then I might do something about it. And then they go, well, then it's too late. Then it's going to kill you. Right there's the fear mongering. And then you still have to go, do you know that? Can you show me that? Like, how do you know that if I wait till I develop a lump, that that's going to kill me? Are there women that develop lumps that they automatically has a death sentence? And so you're back to risk, perceived risk,
Yeah.
because we don't know the future. This is the issue with this whole discussion, with epistemology, with medicine, with any decisions we make every day, is we base our lives on induction. We base our lives on whatever happened in the past is going to happen in the future because we don't know the future. We are not God. We are not omniscient. Omniscient is the prerequisite. That's one of my favorite philosophers when he's talking about epistemology said that. At the end of the day, omniscience is the prerequisite, and we're all short on that.
Yeah.
And that's the truth. If you don't know everything there is about everything, then you don't know all the variables going on in anything. And that's the issue in science, right? When they try to claim they conduct an experiment. Well, how do you know which variables there are to even control? You can't control them. And you can't control all variables going on because you stop the system from working as it is.
Yeah.
So none of it matters. It's all completely made up. And I think it's because we as humans really think we're smarter than we are. And we think that we can discover these secrets of the universe when we can't. And that's the bigger issue with medicine and science in general, is that it's a very materialistic view of the world. It's reductionistic and materialistic.
Hmm.
And that's where the whole scientific realism debate comes in with operationalists. Is scientific realism is really scientific materialism. And so they try to make up these material smaller and smaller pieces and parts down to the atom or even to subatomic particles that nobody can assess, because they
guesswork.
need that. They have to keep going.
Yeah.
Well, at what point do you stop? How do you avoid an infinite regression of, well, then what makes up that part and what makes up that part?
Yeah.
But that's the mindset, and Western medicine especially is very, very, I hate to say atheistic because I'm not, I'm not if you're an atheist, that's fine. But I mean, there are atheists that are very materialistic, and there's no place for anything other than material. And I think that's when you get in the weeds with a lot of the stuff, because that's a worldview, and that determines how you think about things. If you think that everything is random, chemicals bouncing off each other, evolution, right? That's going to lead you down a certain pathway of thinking and intervening in people's lives. If you're trying to see it more from a holistic standpoint, and again, we can't even prove all that. I think there's a lot of people in the truther movement, in the terrain movement, holistic, naturopath. They're making just as many positive claims that they can't back up as
Yeah.
the allopathic are. And that I'm an equal opportunity criticizer. If you're making a positive claim, like this is a fact, and you can't actually really back it up, you need to step back and just say, and Dawn and I talk about this all the time. It's so liberating to just say, this is my belief.
Yeah.
This is my opinion on this. I may be wrong. You're just trying to share some wisdom with people. Here's my experience, but my experience may not be your experience. Like that's how I try to couch this stuff.
Yeah, same as me. I do this is my experience. This is, if I won't tell you what to do, but if I was in that position, here's how I would approach it
That's right.
based on what I know so far. But things change.
Yeah, and I have patients. It's interesting. We're talking about this discussion about how to talk to providers, because my own patients. I have a messenger app where we text message all the time with each other, And a lot of the conversation is them going to another doctor and then bouncing ideas off of me as to what their doctors told them. And I have to give them this kind of advice, be like, well, here's something you may want to ask the doctor. Here's something you may want to think about. I don't like getting into jousting. I don't like saying, well, go tell your doctor that I said
Yeah.
this, because
Yeah.
I'm not playing that game. You either trust, one or the other at the end of the day, or you go figure it out yourself, which I want them to do. But I try to get them to think about what's being said
Yeah.
and then go look into it. And it's the same thing when they ask me stuff. If they, hey doc, I want to check this in this lab. The first thing I ask them is, why do you want to check that? Like, put it back on the patient to make them have a reason
Hmm.
for actually even doing it. Don't just go, well, I heard an influencer say that I needed this lab panel, therefore I want to buy it. Or
Hmm.
this new peptide, right? That's the latest thing, is peptides. It's insane. I don't do like podcasts much or anything, so I don't know what else being said out there, but I get 4 or 5 questions a day about some peptide. Hey doc, I want to try BPC 157. And I'm like, why? Well, I heard it cures all your tendon injuries and issues. I said, so are they using that in every orthopedic clinic all over the world and every hospital to cure people's tendons? Like, if not, you may be being sold a false bill of goods. Like,
Yeah.
I mean, I know that's not a great like proof, but it's still, to me, that's wisdom. Like, if these things did what they claim, they would be being used to do those things everywhere. It wouldn't be this just like, yeah, try it and see, and then most people get nothing out of it.
Yeah.
So, but my point was, I always ask them, what is your goal? What is the issue? What are you looking to achieve? Like, make them at least have a reason for doing that. And so I think you kind of flows into this conversation too, is to, people need to be empowered to think about their own body, their own health. It's their life. And so have a reason for doing what you're going to do, and also be sure and really hold your provider's feet to the fire, and not in a mean way. I'm not saying it like in some argumentative way,
Yeah.
but just ask follow-up questions, ask deeper questions, but they need to be foundational type questions, in my opinion. Like, you try to work backwards from the, oh, this lab result here, go forward. No, let's step back and go back down the chain and go, how do we know that's telling me what you're telling me?
Yeah, I found asking why to about 5 levels. 7 is probably the worst I've ever had to get to, or the furthest I've had to go. If you ask why enough times, you will finally figure out what the real cause is, which is what we're all after in any kind of problem solving. Is let's not get an effect, and let's not confuse an effect with causality. Let's find what's actually causing something here. And if we
100%.
handle that, all these effects will naturally fall away. And the other thing I'd suggest people do is don't look at this diagnosis, in other words, the label, ignore the label and just
Yes.
observe what you're actually seeing, feeling, and what's going on. And that will
Yes.
give you a better thing, because the label will naturally skew what you're looking at.
100%. That language is a magic spell. I mean, it really is.
Hmm.
I mean, we all use language. I mean, appropriately is fine. Men make up these taxonomies. People think taxonomy is science. It's not. I can make up a taxonomy for anything. I can make up categories, start putting things in them.
Yeah.
That doesn't mean that has anything to do with reality. We're
Yeah.
back to that's kind of a form of, honestly, realism,
Hmm.
where they think the word makes it true.
Yeah.
People will say, "Oh, well, if viruses aren't real, how do they study viruses?" It's like, oh my gosh, people, like, do you not understand that they're just made up the entity and they're appealing to effects to make the claim? They're affirming the consequent, right?
Yeah.
That's what's going on.
Yeah.
But yeah, the diagnosis is, I think it was Andrew Kaufman put out a meme or something pretty recently about getting sucked into that diagnosis label.
Hmm.
And I think, sadly, deep down, a lot of people want a label. It makes them feel kind of like part of a group. It's that tribalistic instinct
Yeah.
we all have, right? Where you're like, oh, I'm part of this. I've got fibromyalgia, therefore I'm with these people over here, and now we're
Hmm.
all together, and you feel solidarity. And I mean, I get that. There's a place to try to find comfort in your misery. Like, I,
Hmm.
I did that last year. I developed a lot of gut issues. So I started exploring Reddit forums, and you find IBS groups and gastritis groups. But you know what you find out at the end of the day is, all these people have different experiences, and they all go to the allopathic doctors, and none of them give them any answers. And then they try to start claiming what works for them. Well, guess what? You don't know what worked for you, especially when you're doing 20 different things at once. And so you start realizing, you know what, I got to get out of this mindset of I have this thing they're
Hmm.
claiming, because even within it, all these people have different symptoms, different issues, different things that help them. There are certain, obviously, effects that are similar and even the same. I mean, chickenpox, for example, right? Like, we all know the telltale marks of chickenpox and what
Yeah.
they look like. So what? Does that mean it's bad? First of all, is that a bad thing? Nobody can tell you. Secondly, the cause, nobody can validate. So you're still left with just the real effect at the end of the day. But when it comes to these esoteric diagnoses that are just sort of, I call them like wastebasket diagnoses,
Yeah.
where you just kind of throw some symptoms that could be anything into this one bin, and then people get it out in their head and, oh, I got to take these medicines now for that, or I got to have these surgeries now because I had that. And I think that's dangerous.
I think so too. That was interesting. Thank you. False dichotomy. You'll either take this medicine or your condition will get worse, or, as I've been told, you will die.
Yeah.
As that's like the only options you've got, either this or that. Would you like to comment on that?
Yeah, I mean, I think that goes along with what we've already been saying. It's an appeal
Yep.
to the future and a knowledge claim that they can't back up. And there are often more than two choices, right?
Yeah.
There are certain times in life, or whether it's either black or white, it's a one or a zero. There
Yeah.
there are that is a case in a lot of places, but not always. And so a lot of times you'll find people putting up like straw man dilemmas. Straw man meaning like something that's not even relevant. Where they'll say you claim this, and my answer is here, and I'm like, yeah, it's not either one. I didn't claim that, and then yours didn't right either. It's how about this, or this. I see that all the time. I see it, especially like theological discussions. I see it all the time. I'm into a lot of that stuff, and people will try to argue against something and say, "Here's their answer," and I go, "Yeah, both of those are wrong. That's a false choice, a false
Yeah.
dilemma." And so I think that's the main thing when you can ask doctors, what are my options, and I think if they're honest, they will tell you if there's more than one or the other. I mean, we always tried to do that, and I think there are honest physicians out there. I see it more in surgery. I really do. I see more honest surgeons than medical doctors in general, but that's because it's easier. Again, a monkey can be trained to do surgery, and we go, well, here's what we can do. We can do this. We can do this. We can do this. We can do this. Like there's all these options, and you go. At the end of the day, I don't even know if any of those are going to help you, or if it's going to make you worse, or how you're going to heal from it. But and there's always the option of doing nothing.
Yeah.
That's what I think a lot of people are not comfortable with, and that's something I've had to get more familiar with myself because I have pretty bad health anxiety, and I can let my mind go crazy when I start
Well,
developing any
I
kind
can
of weird
imagine.
symptom.
Yeah. Yeah. Yeah.
Yeah.
Yeah.
Well, because you've seen like the worst of the worst weird things in life, and you go, your
Yeah.
mind automatically goes to the worst case
Yeah.
scenario. But I've had to back off from that, and in a lot of cases, like when I developed my gut issues this past year, I was like, okay, I can go get a colonoscopy, I can go get all these things. Is that going to actually change
Mm-hmm.
what I do? Like I have to know my principles and my boundaries ahead of time. And I go, okay, if I had pancreatic cancer, am I going to go the allopathic route? Am I going to get chemotherapy? Am I going to? No, I'm not going to do that. I already know that. So then why would I even go down that route? Like, because that would just add anxiety to myself
But that shows
knowing
you
that I
how
have.
deep all the programming is.
Exactly. Yep.
Yeah.
And I've had to talk myself out of that programming.
Yeah.
And I try to help people now just to think about it. I'm not telling them what to do. I'm not saying don't ever go get a colonoscopy, don't ever have a surgery. That's not what I tell them. But you still try to just use some wisdom. I'll give you an example. I had a friend recently, and this was around Thanksgiving, about a week before Thanksgiving. She started turning yellow and went to the doctor, and her liver enzymes, quote unquote, were through the roof. And so she had some type of acute liver injury. You can correlate those levels with liver injury
Mm-hmm.
at least. And obviously she's jaundiced, so there's something going on.
Mm-hmm.
But they put her in the hospital and they start tracking her markers. And then thankfully she and her husband reached out to me and their family, their friends from a long time ago, and wanting to know what to do. Cause they're saying, here's what all the doctors are telling us. And we want to know your thoughts on it. And I'm
Yeah.
like, well, first of all, they told her that it was probably from taking Bactrim, which is a toxic antibiotic. And I said, yeah, that could be true. You don't know. You can't prove it. I said, but at the end of the day, when you have an acute liver injury, what you typically see, and I can give them the typical timeline, these levels are going to go up.
Mm-hmm.
They're going to keep going up until they come down. When they start coming down, your bilirubin, whatever that is probably going to keep going up because that's just what we see with liver injury in general. Well, they were wanting to biopsy her liver and start her on. And I said, okay, why would you do a biopsy on your liver when they cannot do anything for you for this issue? There is no medicine. There's nothing they can do
Yeah.
to fix
Exactly.
a liver.
Yeah.
But yet they were willing to
To injure
puncture
it,
her
further
liver.
it. Yeah.
Absolutely. I said the worst thing you could ever have is a liver biopsy that either caused a massive hemorrhage or worse, a bile leak. like a bowel fistula or something like that. I mean, we see all kinds of stuff like that happen in reality, all for nothing, for nothing that they could do. And sure enough, they kept her in a few more days. They let her go home. She started trending her values, and she's freaking out for first week or so because they're going up. And I'm like, Amy, this is what happens. Remember, we talked about this. Sure enough, after 2 or 3 weeks, her color returns to normal. Her labs start going down, like she's all better. She went back to a follow-up visit. They still wanted to do a liver biopsy on her.
There must
I
be
mean,
a
it just
special commission on that month for them.
it's just blood. Well, it's because they don't know what else to do. They
Yes.
they really don't. I mean,
Yeah.
they would do that even in urology. We didn't do renal biopsies, but nephrologists do. The kidney doctors,
That can't
the
be good for
medical
such a sensitive piece in your body.
it's so insane. I mean, the amount of aneurysms, pseudoaneurysms that would develop from that, and guess who gets to deal with those, right? Either the urologist or the interventional radiologist. But the issue is they're just doing it for fun. Like nothing you get back on that biopsy is going to help you treat the patient at all.
Yeah.
So those are just kind of things people need to know. It's hard to know that going in,
Yeah.
So you got to ask those kind of questions. It's like, okay, doctor, you want me to get this kidney biopsy? What is that going to help us to achieve? Is that going to help me fix this problem? And a lot of times they'll just lie to you and say, oh yeah, we can give you a medicine, because if you got an autoimmune condition, then we'll give you a medicine to suppress your autoimmune. It's like, no, there's no such thing as autoimmune, first of all, and any of those medicines are just suppressing a healing response. So you got to know all that stuff. And so I think people need to start really diving into, and I wish there were like an all-in-one resource book on these kind of topics that help people at least get on track to start thinking a little deeper about those things.
Okay. One needs to be written then.
Yeah, it does. I think that's happening. I think there are people that are, and like, Don's book is excellent. I read that in 2020. It's not per se exactly what we're talking about. I think if we could hone one in, on the medical system in general and these tests and what's said and what's told and what to think about, I think that would be useful for people. Okay. For sure.
Brilliant. Could you talk a little bit about cherry picking? Because I hear people say, yeah, but you're just cherry picking that. And sometimes cherry picking can be useful just to help you sort the wheat from the chaff. But there's other times where it can be a negative experience as well.
Yeah, Dawn and I talked about that. And my example of, maybe it's not the right phraseology to say cherry picking can be good, because I guess by definition cherry picking is not good.
Unless you like cherries.
Yeah, exactly. But people will equivocate the meaning of cherry picking. They'll misuse the term. They'll say, "Oh, you've picked out some data here. You're cherry picking." It's like, no, cherry picking has a specific meaning. It means you're taking things out of context and using those incorrectly. It doesn't just mean that you're taking certain things out and for what they are.
Yeah.
And like you say, you chew the meat and spit out the bones. Like there are things in certain papers that are good information or could be useful, and there's other stuff that's really crap. So if I take out stuff that I go, okay, this is actually not fallacious, at least let's explore this other stuff, and they'll say, oh, you're cherry picking. No, I'm not. I'm not cherry picking at all. I'm just being a rational human being and sorting, like you say, I'm filtering, things. So that's how I see it. I can agree. I can agree with tons of people on tons of things even if I disagree with them on 90% of the rest of what they believe in, right? People don't like that. That's a genetic fallacy. They'll try to accuse you. They'll say, oh, if you agree with him here, you must agree with him on everything. It's like, no, that's not. And they'll say, oh, you're cherry picking. No, I'm not. I'm picking based on my own worldview and what I find to be logically consistent, and I'm rejecting the rest. Just like Bertrand Russell's quote about induction in science. And I go, he's right there. And then I can read a lot of other stuff he wrote and go, he's completely making that up. That's not cherry picking. That's
it's not throwing the baby out with the bathwater, is it?
Exactly. Exactly. 100%.
Yeah. Nice one. So let me see. We've kind of covered that one. So this one here, I think you've already answered, but I'm going to ask you anyway. If you could give the people listening to this who wanted to be able to make better health choices and health decisions for themselves and their families, one logical fallacy to really wrap their head around, which one would it be?
Oh man, so there's a few. Affirming the consequent, to me, once you see it and once you start looking for it, like you have to practice this stuff, right? Like if you've ever taken a logic course or whatever, but you start practicing. And I'm not a logician. There's higher level logic that just I don't even understand what they're talking about, because it
Yeah.
gets into more like statistical type stuff and
Yeah.
a lot of formulas and basic stuff. Affirming the consequent, you're going to see everywhere. Once you see it, you cannot unsee it. You will start finding it in anybody you engage with. Like if I ask people on Facebook, I'll start asking, "Oh, can you prove what you're claiming?" What do they do every time? They point to the effect as proof of cause. And I go, no,
Mhm.
that's a fallacy. I need to see the cause. And they just keep going in circles. That one, if you can spot it, I think is very beneficial. It doesn't mean you have to call it out.
No,
It just
just be
means
aware
that
of it.
you
Yeah.
just be aware of it and go, they're really not reasoning properly right there about that. Sadly, most people reason the same way.
Mhm.
I mean, my mom did that. I hate to say it, during the COVID stuff. And we started talking to her about viruses not being proven to exist. And she asked me, "So you don't think people get sick?" I
Different
was
thing.
like, "Mom, we're physicians. We went to, like, we see sick people all the time." Like,
Yeah.
so the fallacy there is actually the flip side of affirming the consequent. It's called denying the antecedent. It's the same thing. They think that if you deny the claimed cause, you have to deny the real world effect,
Mhm.
because in their mind they're linked one to one. And you go, that's not how it works. Like, there can be a lot of reasons for that effect.
Mhm.
And so it's the same thing as affirming the consequent. And so that one would be the big one. And then just, I would say the informal fallacies. Informal meaning it's not the form of an argument, it's just a non sequitur, meaning it doesn't follow. So like
Mm.
an ad hominem, a personal attack.
Yeah.
If a doctor tries to like gaslight you, call you a name, call you an anti-vaxxer, do something like that, or say, yeah, you must be searching just Google, any of those kind of things. To me, you don't want that kind of doctor. You don't want a doctor who doesn't actually know how to treat you like a human being, and a vast majority of them don't. But that's people in general. Doctors are just people, and it's the same whether you're dealing with a doctor or dealing with anybody else. If you're dealing with somebody who starts throwing out personal attacks and non sequiturs, you're not going to have a productive relationship with that person. I see it all the time on Facebook, with arguments over the government and statism and all these things, and they're so honed in on their man or their team, and they'll just call you a name. If I say something against Trump, they say, "Oh, you must love Joe Biden," and I'm like, "I hate all of them. Like, what are you talking
Yeah.
about?"
Yeah.
But they can't get out of those boxes. So
Yeah.
if you see doctors doing that, not politically, obviously, but just they're trying to push you into a corner, and label you so that they can just dismiss whatever you're saying. And that's what fallacies are used for. They're mental shortcuts so that people don't have to address the arguments.
Yeah.
Um, so I think if you can not discover, if you can be aware of affirming the consequent, in that form, and just spot it and notate it in your mind. And then also, if they start gaslighting you, or if they start, appealing to the future, of using fear tactics, like, it doesn't even have to be a true fallacy. If they're really trying to prognosticate for you and tell you your future and fearmonger you, I would probably go see somebody else. Honestly,
Mhm.
that just, to me, is not going to be a productive relationship. Now, if you're the kind of person that wants to be scared and wants to be told what to do, because this conversation does not apply to everybody, sadly. Like, we have had people tell us, I mean, we've had people that worked in clinics that we were trying to teach and say, I don't want to think about it, I just want you to tell me what to do. And I'm like, that's not how it works. You need to be able to think about
Yeah.
these things,
Yeah.
but most people, or I would say most, a lot aren't. And we saw that in surgery. There were a lot of the places you work where every day was like they hit the reset button. It's like they'd forgotten how to help you do the surgery. They'd forgotten the steps, like, because they don't care, because it's apathy, right? People who genuinely care are going to remember and think about
Yeah.
these things. So,
Yeah.
but this really applies to people that, want to
Yeah.
think deeper about this topic.
Yeah. I think one other one might be useful as well, is to be aware of the appeal to authority, where you've been taught all your life
Yep.
to, listen to the teacher at the front of the class. So that got me into lots of trouble because I wouldn't. I kept asking questions. Yeah, but why?
I,
Yeah, I pretty much I should have had a desk outside the principal's office in the end. I was there so much. Um, and that's what they rely on. You saw it all through the COVID things with the guys that would stand up in between the two pillars and tell you all this stuff. They're just men, and they're making
that's right.
mistakes. And if you
100%.
if you learn to think and just ask questions and keep asking questions, that will reveal things. Because one thing I've noticed, it's on one of my websites, is that the system cannot stand up to any line of inquiry for long. And that's all you
Yes.
need to do. And I'm not suggesting you get into any kind of aggressive relationship and want to disprove stuff, but this is your life that they want to help with some air quotes for some of them. You know, you're responsible for you, and the only way you
Yeah.
can do that is to get better at asking questions and help them, because they've been blinded by their own stuff as well. You can help find your way, and as you said, if you can't get that kind of relationship, go somewhere where you can.
Yeah, I totally agree. And
Yeah,
what you said there is spot on. And I think the we are trained from early ages, especially if we go through public school systems, to cow down to the authority figure,
yeah,
right? Um, and I was never, I don't know, it was hard for me to do that, just to accept anything just because of a title, that whatever somebody said was right and true. And I still to this day, I would never appeal to my own credentials for any kind of argument I make ever. I saw somebody on Facebook the other day. I had to comment. She was like a doctor, and she's like, maybe you should listen to a board certified OBGYN of 10 years experience instead of some influencer. And I was like, imagine appealing to your credentials as proof that you're right about what you say. Uh, Like, just imagine that. Like, that's
yeah.
absurd because number one, people with the same credentials differ in what they believe and their opinions about things. So they're already falsifies it. But also, it's a fallacy, right? It is an appeal to something that has nothing to do with the argument.
Yeah,
Arguments stand or fall on their own.
yeah,
There is no appealing to credentials. You can appeal to your own experience and say, here's my experience, here's what I've learned, like just to give people some information about what, but that doesn't make you right.
nope,
You know, I can, you, a physicist can tell you all day long about the Higgs boson particle, doesn't make him right about it. He can be an expert on it because mathematically you can do a lot of fun stuff. Does that mean that particle exists? No, not at all. And he could never show it to you. So you got to get away from the appealing to the letters after the name.
hmm,
But that's a very, it's basically an ad hominem. It's a personal attack against you.
yeah,
It's basically saying I'm better than you because you don't have these letters after your name like I do.
yeah,
And that's never legitimate in and of itself. They may be right about what they're saying, but not because of that. Just like the affirming, the consequent, you may be right that that caused that, but you can't use that argument to get there.
yeah,
You got to go some other route.
yeah,
So
yeah. We need some proper proof.
that's right. Amen.
Jordan, that was remarkable and a lot of fun, and I would like to talk to you on other topics in the future if you're all right with that as well.
Absolutely. I love it. I love this stuff.
Good. All right. Fantastic. Well, don't go away. We'll draw that to a close. Thanks again.